We have all heard it said, I got the flu shot and it gave me the flu. Or, I got the flu shot and still got sick. Then there's my personal favorite, I got the flu shot last year and still got the flu, so I'm never getting it again. Under most circumstances, these things cannot happen. Working as a nurse in an urgent care center, I heard all of these statements and more several times. While working at Mayheck Family Health Center, I learned several vital pieces of information about the influenza virus and the influenza vaccine that are very important for us to know, such as what is in the vaccine, the common misconceptions about the vaccine and the virus, and who should get it. Basically, the why, the how, and the when. We will start with what is in the influenza vaccine. According to Tisha Cox, a former nurse at Mayheck Family Health Center, there are two different types of the flu vaccine. You have the TIV, which is the trivalent inactivated virus. This is the common flu shot. It is an injection given in a 3 milliliter syringe with a 25 gauge quarter to half inch needle. This shot is given in the upper arm, right around the middle of the deltoid muscle. It is safe for pregnant women. Then there is the live attenuated vaccine. This has specific age ranges since it is a nasal spray and there are more risks associated with this type of vaccine. Now, I also learned that there are several different components that go into the flu shot. Every year it changes. The CDC picks 3 strains that they believe will be the most prevalent that we will see this upcoming season. This year, for the 2011-2012 vaccine, they chose the influenza A, influenza B, and influenza H2N3. There are several strains that we always hear about, but this year those that got left out were influenza C and the other common one that we hear, H1N1, along with several other strains that are not predicted to be as widespread. There are common misconceptions about the immunization. Like I mentioned earlier, can you get the flu from the flu shot? No. Why? This is either the injection or the nasal spray has live attenuated or inactivated particles of the virus, which means that those particles cannot cause infection, but they help to produce antibodies that will go into the blood to help protect you from the virus. Now, the vaccine takes 3 to 6 weeks to become effective, depending on each individual person. So if I got the flu shot last week and was exposed 2 weeks prior, I can still get the flu. If I got the flu shot today and 6 weeks down the road I'm exposed to influenza A, I'm not going to get influenza A because the vaccine has had time to protect me from the virus. Now, can you get sick from getting the flu shot? You cannot get the flu from it. You don't get sick, you get side effects. There are, according to Simmers and Louise, several similar side effects that may lead you to believe you have the influenza virus, like chills, fever, sweat, and body aches. However, there's those that are different. Nausea, vomiting, diarrhea are not side effects or symptoms of the flu. Those that get these side effects, you treat with Tylenol, ibuprofen, Motrin, and rest. Please excuse me. I have a cold. Who should get the flu shot? Excuse me again. According to Fraser, Shell, and Vist, those with weakened immune systems, like asthma patients, those with autoimmune disorders, and those on chemotherapy and radiation treatment regimens. Those also in high-risk groups. Those include small children, pregnant women, and those in long-term care facilities, nursing homes, and assisted living centers. The infants, those under 6 months, are protected because most babies that are breastfed, the mother gets the vaccine, she produces antibodies in her blood that gets passed through into the breast milk of the nursing infant. Excuse me. I do apologize. In conclusion, today we have spoken about several things. We have been talking about the myths that have been disproven by research, that there are truths that sound like myths, and that there are tons of sources out there about the flu, whether it's the vaccine or the virus. And we've learned what's in the vaccine, what it actually causes, the immunization injection versus the nasal spray, and who should get it. And we talked about the people with weakened immune systems, those in high-risk groups, and certain age ranges for each specific immunization. Now, this year, in October, I will be getting my flu vaccination to protect my family, my loved ones, and my friends, and myself. Will you be doing the same?